The cephalosporins are a class of lactam antibiotics originally derived from the fungus Acremonium, which was previously known as Cephalosporium. Together with cephamycins, they constitute a subgroup of lactam antibiotics called cephems. Cephalosporins were discovered in 1945 and were first sold in 1964. Medical uses: cephalosporins are indicated for the prophylaxis and treatment of infections caused by bacteria susceptible to this particular form of antibiotic. First-generation cephalosporins are active predominantly against gram-positive bacteria, and successive generations have increased activity against gram-negative bacteria, albeit often with reduced activity against gram-positive organisms. Adverse effects: common adverse drug reactions, ADRs, 1% of patients, associated with the cephalosporin therapy include, diarrhea, nausea, rash, electrolyte disturbances, and pain and inflammation at injection site. Infrequent ADRs, 0.1 to 1% of patients, include vomiting, headache, dizziness, oral and vaginal candidiasis, pseudomembranous colitis, superinfection, eosinophilia, nephrotoxicity, neutropenia, thrombocytopenia, and fever. The commonly quoted figure of 10% of patients with allergic hypersensitivity to penicillins and/or carbapenems also having cross-reactivity with cephalosporins originated from a 1975 study looking at the original cephalosporins, and subsequent safety-first policy meant this was widely quoted and assumed to apply to all members of the group. Hence, it was commonly stated that they are contraindicated in patients with a history of severe, immediate allergic reactions, urticaria, anaphylaxis, interstitial nephritis, etc., to penicillins, carbapenems, or cephalosporins. This, however, should be viewed in the light of recent epidemiological work suggesting, for many second-generation, or later, cephalosporins, the cross-reactivity rate with penicillin is much lower, having no significantly increased risk of reactivity over the first generation based on the studies examined. The British National Formulary previously issued blanket warnings of 10% cross-reactivity, but, since the September 2008 edition, suggests, in the absence of suitable alternatives, oral cefoxime or cefuroxime and injectable cefotaxime, ceftazidime, and ceftriaxone can be used with caution, but the use of cefaclor, cefadroxil, cephalexin, and cefuradine should be avoided. Overall, the research shows that all beta-lactams have the intrinsic hazard of very serious hazardous reactions in susceptible patients. Only the frequency of these reactions vary, based on the structure. Recent papers have shown that a major feature in determining frequency of immunological reactions is the similarity of the side chains. For example, first-generation cephalosporins are similar to penicillins, and this is the reason the lactams are associated with different frequencies of serious reactions, for example, anaphylaxis. Several cephalosporins are associated with hypoprothrombinemia and a disulfiram-like reaction with ethanol. These include etamoxev, moxolactam, cefminoxime, cefoperazone, cefamondole, cefmetazole, and cefaditine. This is thought to be due to the N-methylthioterazole side chain of these cephalosporins, which blocks the enzyme vitamin K epoxide reductase, likely causing hypothrombemia, and aldehyde dehydrogenase, causing alcohol intolerance. Mechanism of action: cephalosporins are bactericidal and have the same mode of action as other lactam antibiotics, such as penicillins, but are less susceptible to lactomases. Cephalosporins disrupt the synthesis of the peptidoglycan layer forming the bacterial cell wall. The peptidoglycan layer is important for cell wall structural integrity. The final transpeptidation step in the synthesis of the peptidoglycan is facilitated by transpeptidases disambiguation needed, known as penicillin binding proteins, PBPs. PBPs bind to the D-Alabama at the end of neuropeptides, peptidoglycan precursors, to cross-link the peptidoglycan. Beta-lactam antibiotics mimic the D-Alabama site, thereby irreversibly inhibiting PBP cross-linking of peptidoglycan. Resistance to cephalosporin antibiotics can involve either reduced affinity of existing PBP components or the acquisition of a supplementary lactam-insensitive PBP. Currently, some Cephalosporium fungi, Enterobacter cloacae, Neisseria gonorrhoeae, and Escherichia coli strains are resistant to cephalosporins. Some Morganella morganii, Prochus vulgaris, Providentia redgari, Pseudomonas aeruginosa, and Serratia marcescens strains have also developed resistance to cephalosporins to varying degrees. Classification: the cephalosporin nucleus can be modified to gain different properties. Cephalosporins are sometimes grouped into generations by their antimicrobial properties. The first cephalosporins were designated first-generation cephalosporins, whereas, later, more extended spectrum cephalosporins were classified as second-generation cephalosporins. Each newer generation has significantly greater gram-negative antimicrobial properties than the preceding generation, in most cases with decreased activity against gram-positive organisms. Fourth-generation cephalosporins, however, have true broad-spectrum activity. The classification of cephalosporins into generations is commonly practiced, although the exact categorization is often imprecise. For example, the fourth generation of cephalosporins is not recognized as such in Japan. In Japan, Cephalosporin is classed as a first-generation cephalosporin, though in the United States it is a second-generation one, and Cephalosporin, Cephamycins, and Cephalosporin are classed as second-generation cephalosporins. Cephamycins and cephamycins are classed as third-generation cephems. Flumyxeph and lidomyxeph are in a new class called cephems. Most first-generation cephalosporins were originally spelled ceph in English-speaking countries. This continues to be the preferred spelling in the United States, Australia, and New Zealand, while European countries, including the United Kingdom, have adopted the international non-proprietary names, which are always spelled cev. Newer first-generation cephalosporins and all cephalosporins of later generations are spelled cev, even in the United States. Some state that cephalosporins can be divided into 5 or even 6 generations, although the usefulness of this organization system is of limited clinical relevance. Fourth-generation cephalosporins as of March 2007, were considered to be a class of highly potent antibiotics that are among medicine's last defenses against several serious human infections according to the Washington Post. The mnemonic claim is used to note organisms against which cephalosporins do not have activity: Listeria, atypicals, including Mycoplasma and Chlamydia, MRSA, and Enterococci. Fifth-generation cephalosporins are effective against MRSA, however,